welcome to this NMC Test Competence Clinical Skills video. Today I'm going to be going through the oxygen therapy clinical skills station. So my name is Hannah, I'm a UK nurse and a university UK lecturer, and have been a lead OSCE trainer as well, and I'm sharing resources and information to help you study for your OSCE. Because when I started doing OSCE training, I found there was so many poor quality videos and wrong information around these clinical skills on the internet. So I'm trying to give you some up-to-date resources and some videos that you can use to help self-study and to pause and to study alongside with you as well, so you can practice alongside the videos. So today I'm going to look at oxygen therapy, and before I put the presentation on, I just wanted to show you the mask kind of up close. So for this station, you will be applying oxygen through this mask here. So we call this a reservoir mask. You might also know it as a bag valve mask. And so it's the one with the reservoir where the oxygen will fill this mask. Okay, so the patient will breathe high flow oxygen. And I'm showing this mask because in the OSCE station, you'll have lots of different oxygen masks, and you will need to select the correct one. Okay, so you want to select the one that's got the bag. Okay, that's really important. Okay, so oxygen therapy, this is a 10-minute clinical skills station. Key components are that you need to read and confirm the prescription. So remember that oxygen is a prescribed medication. Okay, so all those key medication checks that we do in our implementation station and our other clinical skills medication stations are really important here. Okay, so we have to read and confirm the oxygen prescription. We need to administer the prescribed oxygen correctly through the correct mask and flow rate, okay, that's been prescribed. You need to document the administration of the oxygen correctly, so document on the medication chart as well. And you need to verbalise the correct patient checks and reassessments that we would do after providing the oxygen. So like I said, you'll have your equipment, you'll have your high flow oxygen mask, okay, but you'll have a selection of all different types of oxygen masks that you need to make sure you pick out the right one. You'll have a flow meter, okay, and you will connect the end of the oxygen into that flow meter and verbalise turning on the dial, okay? And the flow meter's got lots of different numbers on, okay? And you would turn it up to the prescribed amount, which is normally 15 litres. So verbalise, you would turn it up to the ball and it goes all the way to the top, okay? Normally the station is just done on a mannequin, okay? And you'll have your scenario, and because oxygen is a prescribed medication, you'll have your medication administration record as well, so your drug chart. So very simple scenario may just be asking you to administer the prescribed oxygen, okay, and because you've got a patient, in this instance, it's a patient with asthma who's got reduced oxygen saturations. Then you will have your drug chart. So the same as in your implementation station, you'll have that front sheet with all your patient details, okay, and the allergies and prescribers details. Then you'll have a second page which has once only, and then on the third page is your oxygen prescription chart, okay. And everything I've highlighted on this slide is really important and what you must verbalise when you're confirming and reading through that prescription. Okay, so again, like all my skills videos, when I teach these clinical skills, I try and break the station down into separate parts. So we've got that mental mind map of how we're going to approach the station, okay? So I'm going to start with my key principles, and this must include my ID and allergy checks because we are giving a prescribed medication, okay? Explaining the procedure and gaining consent. I'm going to read the prescription and confirm that the oxygen prescription is clear, valid and legible. I'm going to collect the correct mask, and there's some checks that we need to do with the mask, and I'm going to show you what those are. We're going to apply the mask to the patient and administer the oxygen correctly. I'm then going to do my reassessment. So reassessment of saturation, going to reassess skin integrity, and going to offer regular mouth care. Then going to move on to documentation of my oxygen administration on the drug chart, and then with all our stations, just checking the patient is comfortable and ending the station professionally. So we're going to look through those 7 parts in detail now. So again, every station, key principles: safety, privacy and dignity, decontaminate my hands using the World Health Organization 7 steps. I'm going to introduce myself with hello, my name is, and I'm going to do those ID checks, okay, essential in a station because it is a prescribed medication. So I'm going to ask them to confirm their name and date of birth. I'm going to check this against the hospital band, against my medication chart, okay? And I'm also going to check the hospital number, and I'm going to verbalise that I'm doing that, okay? I'm going to check for allergies, again, really important because we're given a medication. I'm going to verbally ask them if what allergies they have and what reaction. I'm going to check this against my chart and acknowledge if there is a red wristband and check that it is correct. I'm going to explain the procedure to the patient. I'm going to explain that we're going to put a mask onto the face. It can be a little bit tight. We're going to give some high flow oxygen. It's going to help with your breathing and increase your oxygen levels. I'm going to say a couple of the side effects the patient can make informed consent, okay? So it can make you feel a little bit lightheaded. It will dry your mouth out, but we'll make sure we give you regular mouth care, okay? Can I check the patient is comfortable before I move on and that I've got consent? Then going on to reading my prescription chart, okay? So I must read the full prescription and confirm that the oxygen prescription is clear, valid and legible, okay? I need to read the front page, okay? So the name, date of birth, hospital number, the ward, the date of admission, the height, the weight, the prescriber, the consultants, the time of admission. I'm going to read the prescriber's details in that second box, okay? And I'm going to confirm and check the allergies and identify if there's any medication risk factors. And then I'm going to verbalise, go onto my oxygen prescription page, going to read out the name, date of birth and hospital number. So I know I've got the right patient. All the other details in that top box, the height and the weight, you can just say are the same. You don't need to read those all out. And then I'm going to read through my oxygen prescription chart. And this is really essential in order to pass the station. So I'm going to say I'm moving on to my prescribed oxygen. Is the patient a known CO2 retainer? No. Okay, so we need to verbalise that first bit. And there's a safety issue with that because if they are a known CO2 retainer, we would want to target different saturations, okay? I've got a cross next to my continuous oxygen therapy, so I'm going to say I've got continuous oxygen therapy prescribed and a target oxygen saturation of 94 to 98%, okay? Because those both bits have a cross in. I'm then going to verbalise the starting device and flow rate. So I've got an RM, which is a reservoir mask, okay? And you can see the code at the bottom, if you get that. So I've got a reservoir mask at 15 litres of oxygen. I've got a start date of today. Now it's essential you read that start date out, okay? That can be a common area of fail. Okay, I've got prescriber signature, Dr. Wright, and a prescriber's name of Dr. Wright, and I've got a stop date of ongoing. So I can confirm that this prescription is clear, valid, and legible, and I'm going to administer the prescribed oxygen. So you must read all those parts that are highlighted. Then going to get my equipment. So important to do a decontamination of your hands here, okay? Using the World 7 steps, because I'm going to be picking up the oxygen mask and handling that, and that's going to go onto the patient's face, so I need to have clean hands. I'm going to select my reservoir mask, okay? You don't need PPE for this station, okay? So don't waste time putting on gloves and apron. I'm going to attach my oxygen to the oxygen flow meter. I'm going to verbalise, I'm going to turn that on until the ball hits 15 litres. I now need to do an important safety check with this mask, and I'm going to put my thumb or my fingers over the one-way valve, okay? So there's a one-way valve here. I'm going to put my fingers over here, and I'm going to verbalise that I've waited for this bag to fully inflate, okay? So what I'm doing is I'm checking this one-way valve works, okay? And that this bag's going to inflate with the oxygen, and my patient is going to receive that high flow oxygen. So important step you mustn't miss. Then I'm going to apply the mask onto the patient's face. Okay, so I'm going to return to the patient. Because I've been away and got my equipment, best practice is you should do a double ID check here. We do teach that. So just confirm their name, date of birth and hospital number. You're going to apply the mask over the patient's head. Okay, you need to pull the straps on both sides. Okay, so pull them on both sides so you've got a tight seal. Okay, but not too tight. Okay. And make sure it fits nicely over the nose and mouth. You are going to just check the patient is comfortable, okay? Check they're comfortable with that mask over them, okay? So we've applied the oxygen mask. We now need to, this is really key verbalisation that you must complete and often a common area of fail, okay? So I'm going to verbalise that I've reassessed the saturations to check they are within the prescribed target range of 94 to 98%, and I'd escalate if not achieved. I'm going to assess the patient's skin regularly around the face the ears, the nose and the back of the head, because there's risk of pressure damage there from having a mask on, okay? And I'm going to verbalise that I'm going to provide regular mouth care and sips of water to the patient because of the drying nature of oxygen. Then I'm going to do my documentation, okay? So I've just highlighted the boxes here on the prescription chart where you need to document. So you need to put your signature, you need to print your name, you need to put the date, which will be your test centre date, and the time, which will be in the scenario. And then where it says FR device, this is the flow rate and device. So I would put 15 litres and a reservoir mask, okay? And I'm going to go back to that very front page of that drug chart, and I need to complete that front box. So the same as you do in your implementation station, so you need to complete that. Anyone that's administered medication must complete that box. So it's your name, your initials, your signature, and your base. So wherever that patient is in that scenario, so whatever ward or clinical area you've been given, and that's a really important step to do. Okay. Then again, just checking our patient is comfortable, doesn't need anything, they've got the cool bell and know how to use it. Do your final handy contamination using the World Health Organization 7 steps, because you're at the end of your station. And like with all our stations, if you've got any time left, go back and double check your documentation, make sure you haven't forgotten anything. My top tips of this station is don't forget your ID checks and allergy checks. Oxygen is a prescribed medication, okay? Read the full prescription chart, including the date, the flow rate, the device, the target oxygen saturations, whether it's continuous or intermittent, the prescriber's name and signature. Reassess the saturations, the skin integrity and mouth, and say you'll come back and offer regular mouth care. Okay, that often gets missed and is a key area of fail. Make sure you document on the medication chart that you have given the oxygen, okay, so complete all parts, your date, your signature, the time, the flow rate and the device. Okay, I hope you found this video helpful. Like and subscribe, going to be putting up more clinical skill videos and more OSCE videos for you. Also available for tutoring, so small groups, one-to-one, can be really flexible, fit in around your current working patterns or family life, evenings, weekends, and you can pick your sessions that work for you, so you're not tied into kind of set test centre dates that are running in kind of blocks. Get access to all my videos, get recorded lectures, also I'm available for face-to-face in the Plymouth and Devon area. You can do mock OSCEs as well and get the feedback. Okay, so you can email me on hannah.lames@outlook.com, or you can visit my Facebook page as well, Nurse Tutor, Tutoring with Hannah.